Okay, good afternoon, everyone. Thank you for joining the Stakeholder Engagement and Support webinar series. Today, we'll be discussing faith-based organizations as key stakeholders. My name is Zoe Sasser, and I'm an associate on the Health Systems Integration team at NASTAD. And this webinar will be facilitated by Brittany Harrison, a senior manager on the Health Systems Integration team at NASTAD. Next slide. So just a quick disclaimer, this project is supported by HRSA as part of a cooperative agreement and doesn't necessarily reflect their views. Next slide. So some quick housekeeping. We ask that you please stay muted while presenters are speaking. Feel free to engage the group throughout the webinar, drop any questions or comments in the chat, and raise your hand so we can hear from you during our discussion. The session is being recorded and we will share the slides with you all after the meeting. And finally, we ask that you please complete the feedback survey at the end as it helps us improve our webinars. Next slide, please. So here are the objectives for the meeting. Today, we'll discuss the integration of faith-based organizations into the Ending the HIV Epidemic initiative, discuss the benefits and challenges of partnering with faith-based organizations, and finally, discuss strategies for engaging faith-based organizations in HIV initiatives. Next slide. So this is our agenda for today. First, I'm going to give a brief background on NASTAD. Then we'll give a recap of the regional meetings. Then we'll give a faith-based approach overview. Our guest speaker, Carol Tyrell from the New York Department of Health AIDS Institute, will give a presentation on their Faith Communities project. Then we'll have a group activity. And finally, we'll ask you to complete a quick evaluation and then wrap up. Next slide. So some background on NASTAD, if you aren't familiar with us, NASTAD is a nonpartisan nonprofit association that represents public health officials who administer HIV and hepatitis programs in the US. We serve governmental public health agencies across states, territories, and local jurisdictions. We do this work by strengthening governmental public health through advocacy, capacity building, and social justice. Next slide, please. So the EHE SCIP, or Systems Coordination Provision Team, provides technical assistance on the integration of healthcare services. Here are some examples of the TA we provide, including leadership development, learning collaboratives, communities of practice, and peer-to-peer learning. Our areas of TA expertise are listed on the bottom, which include data sharing and integration, program policies and procedures, procurement, subrecipient monitoring and program evaluation, developing innovative programming for key populations, and stakeholder and systems level engagement. Next slide, please. And here are the friendly faces of the team. Please feel free to reach out to us at any time with questions or any TA needs. Next slide. So here's a quick background on how this webinar series came about. NASTAD, along with our partners at CAI, designed and hosted 5 intensive technical assistance sessions between September 2023 and March 2024, with 42 out of the 47 EHE Phase 1 jurisdictions. During these 5 sessions, jurisdictions identified strategic initiatives that are achievable and will have the greatest impact to focus on in year 5 of EHE. Some of the common themes we noticed emerging from these sessions were stakeholder engagement, clinical innovations, and data monitoring and evaluation practices. This webinar series has been in response to stakeholder engagement, and we hope to provide you with tangible and actionable information that you can take back to your jurisdiction. Next slide, please. So we examined the most common requests for TA in the stakeholder engagement category and divided them up into 4 sections and created this 4-part webinar series. We hosted 3 in the past, which were on engaging legal and immigration systems, engaging people with lived experience, and engaging clinical partners outside of the Ryan White system. And this is our fourth and final webinar on engaging faith-based communities. Next slide. So we wanted to start today with a quick icebreaker, and we're asking you to match the teaching and verse with its corresponding religion by answering the poll questions. So the teachings and verses are here on the screen. The first one is, do not stand idly by while your neighbor's blood is shed. The second is, let one cultivate boundless love towards all beings. And the third is, by helping others, you will be helped. So Sarah, can we pull up the poll, please? Great, and we have a small group today, so this will be quick. But if you can just choose which religion you think matches this verse, and we'll give you some time to answer. Number 1, Islam, okay. Okay, for the first one, Islam, Judaism. Second one, people are saying Buddhism. And third one, Christianity is the most popular. Okay. Thank you, Sarah. I believe. Let's give 10 more seconds for this one last person to answer. If not, okay, I think we can end the poll. Great, so the majority of you all said for the first one, you thought that that was Islam. For the second one, everybody said Buddhism, and for the third, Christianity was the most popular. Thank you all for participating in that. Can we go to the next slide, Sarah? So these are the answers. The first one, do not stand idly by while your neighbor's blood is shed, is Judaism, which was the second most popular choice. The second one, let one cultivate boundless love towards all beings, was Buddhism, and everybody got that. And the third, by helping others, you will be helped. That is Hinduism. And I believe some people did pick that. So thank you so much for participating in this quick icebreaker. And with the next slide, I will pass it on to Brittany.
Hi, everybody. My name is Brittany Harrison. Thank you so much for joining us today. So I am going to cover the faith-based approach. So next slide, I'm going to give an overview of a collaborative approach to HIV with faith-based organizations or as key stakeholders or partners. But first, I'd like to hear from you. Can you drop in the chat, what role do you believe faith-based agencies should play in addressing HIV? Support. Yes, absolutely. And support can look like a lot of different things. A critical role, as we are all spiritual in essence, and most often we do not address. Couldn't agree more. So throughout the presentation, we'll touch on a few of those things. If we can go to the next slide, please. All right, so I want to just give a few examples of how faith-based organizations have played a variety of roles in addressing the HIV epidemic from the beginning. And so I'm not going to touch on all of these just for the sake of time, but wanting to include them here for your research purposes. So the Balm in Gilead is a non-governmental nonprofit organization that was founded in the 80s, and they led the very first Black Church Week of Prayer for healing AIDS. They now have an international reach and is known for providing understanding of religious cultures, values, and partnerships with faith communities worldwide. The Interfaith Network on HIV and AIDS. They're a multicultural nonprofit organization created in 1999 that started with a focus on education, prevention, and client advocacy. Over time, their services have expanded to include linguistic services to Spanish-speaking people, transportation services, meal programs, and case management. National and global governmental agencies have funded faith-based organizations to build capacity and provide trainings and even build curriculums within and outside of their agencies to address the epidemic. The pharmaceutical company, Gilead, has the COMPASS initiative. COMPASS stands for the Commitment to Partnership in Addressing HIV/AIDS in Southern States. This is a multifaceted project that has created several great products, one of which is a survey of faith-based organizations. Next slide, please. A survey of 225 faith-based organizations explored faith leaders' attitudes and perceptions of HIV/AIDS programming within their faith community. 45% of respondents indicated that in the last 12 months, they have provided programming about preventing HIV transmission, such as teaching about prevention strategies or promoting HIV testing. 31% reported providing testing in the last 12 months. 17% reported they had provided housing to people living with HIV in the last 12 months. Next slide, please. In regards to HIV education and stigma reduction, 70% reported that they, 70% reported they either were or may be interested in worship tools developed around faith and HIV. 43% of respondents plan to create HIV/AIDS ministry in their faith community. 52% of respondents indicated that they plan to utilize scripture and/or sacred texts to teach about HIV/AIDS and to reduce stigma. 40% reported they had provided pastoral care to persons living with HIV or AIDS in the last 12 months. Next slide, please. The findings of this survey confirm the need to build relationships with FBOs to understand their unique values, doctrine, and messaging to ensure everything aligns appropriately to ensure culturally sensitive and effective public health programming. Next slide. It's important to carefully consider the benefits and challenges of partnering with specific FBOs. There can be many advantages for building these partnerships as FBOs have a strong presence and influence within their community. And we have just a few listed here. So to start, they have a strong moral and ethical, or they're looked at by the community for a strong moral and ethical leadership and modeling. They have the ability to help reduce stigma. They are known for providing ancillary support such as food pantry, pastoral counseling, a variety of things, sometimes even health services, depending on the institution. Faith-based organizations have a strong presence and capacity in terms of their congregation and their reach for reaching the community. Their reach for reaching people in the community and have that connection to really have that strong influence to be able to provide services and be a protective factor for resilience as people are facing life's challenges. Next slide, please. Conversely, if the values, doctrine, and messaging are misaligned, it can further exacerbate stigma and discrimination. It can bring up issues around inclusivity with the LGBTQIA plus population. And depending on the messaging, it can create additional conflict around medical approaches to addressing HIV and AIDS. Next slide, please. NASDAD has developed a community engagement toolkit highlighting key principles and strategies jurisdictions may find helpful. We will touch on them briefly as the toolkit is available online. Allison, if you can please drop the link to that toolkit in the chat. And if Sarah, if we can please go to the next slide. When we're talking about key principles for engaging communities, and that's any community, be it a faith-based organization or another type of community, you want to be sure to set clear goals, approach it with cultural humility, be mindful about representation and representation on a number of levels, not just racial representation, but being sure that there's a diverse array of perspectives and being open to that when you're looking at who's at the table. It's very important to build partnership and trust, especially if you want for this to be a long-term relationship. Be mindful to learn about the community. Just as we mentioned, you want to make sure that there is alignment in those values and beliefs. Foster transparency. Be very clear about what the goals are, what your intentions are, and what's all at stake. It may be necessary to provide and promote capacity building, and that can go both ways. You can learn a lot from the communities that you're working with. And so be sure to maintain long-term commitment whenever possible, even if there is or isn't funding involved. Once that relationship is built and is strong, you want to be sure to maintain that. It can take a lot of work to build relationships. So once you got a good one going, do whatever it takes to keep it going. Next slide, please. Okay. So with that being said, building on those principles, when you're engaging with faith-based organizations, it's essential to determine the appropriate level of involvement based on the goals of your collaboration. This chart provides a guide for how to match engagement level based on needs and desired outcomes. So you'll notice the difference. This chart is in the toolkit, but you'll notice there's a big difference from each column in terms of what engagement looks like, especially from starting at informing. And this just looks like we will keep you informed of what we're doing. This could look like in, working with a faith-based organization or any organization on developing fact sheets, newsletters, websites, things of that nature, versus we're empowering. And that looks like giving the community members sole decision-making authority over new programs or services, really working with them, empowering them to take ownership or whatever the activity or program is that you're working towards. And there's a variety of what that could look like, what those levels look like in between informing and empowering. So be sure to take a close look at that to really think about how you want to approach your faith-based community or any other organization that you may be working with. Next slide, please. Oh, yes, next slide. So for the past 20 years, our guest speaker, Carol Terrell, the coordinator of the Faith Communities Project with the AIDS Institute, New York State Department of Health, Division of HIV, Sexually Transmitted Disease, Hepatitis C Prevention, has been implementing these principles and practices successfully with great results. Carol, take us away. Teach us your ways.
Thank you very much, Brittany. Good afternoon, and thank you, Brittany, for inviting us to share with you, our journey and how we have engaged faith communities in our HIV prevention and healthcare efforts. What I'm going to do today is I don't know where the slides are. There's a different slide set, so I'll wait for them to come up. But what I'm going to do is to basically share with you our story and our journey of engagement, a little bit about the history of the project, how it was developed, look, this purpose, some of our accomplishments, some of the lessons we've learned, some take-home messages, and then end with some pictures from various programs that we have implemented over the years. As Brittany said, my name is Carol Terrell, and I coordinate the AIDS Institute's Faith Communities Project. I'm based in Albany office. Next slide. So what I'm going to do is just tell you the story, and then we'll just move forward with the slides. But the Faith Communities Project was developed in direct response to the community's request that the health department include faith communities in our HIV prevention and healthcare efforts. We also had commissioned reports back in the late 80s and 90s to look at prevention strategies to reach communities that are disproportionately impacted by HIV, more specifically, communities of African and Latinx descent. Those recommendations from those reports highly recommended the involvement of faith communities in our HIV prevention efforts because of the significant role that this institution, faith institutions, play in their lives, similar to exactly what Brittany has described earlier. So we had our prevention planning group way back when prioritize the need to engage faith communities in our HIV prevention and healthcare efforts, and developed a research a survey back in, I would say, 1997, before I joined them, to really to get a sense, to get a picture of what how faith communities were involved in HIV prevention and healthcare efforts, but also to determine their willingness to work with us if they were not, to work with us to respond to this pandemic. As a result of that, I mean, we found that not many faith communities back then, more specifically in New York State, were engaged in HIV related activities, but a significant over 50% indicated their willingness to work with us and work with we call aid service providers. So as a result of that, this project was birthed. We had back in 2001, I believe, we convened a statewide forum bringing together representatives from faith communities, community-based organizations, persons living with HIV and others together to look at the role. Back then, the question was, what is the role of faith communities? And what we do know is there's a common ground that really binds us, all faith traditions, whether it be Abrahamic or other spiritual traditions. And that is our responsibility to each other, to our brothers and sisters. And this project is really called Common Ground because we have that common ground together. So what we did is we posed that question at the end of the forum. I think we broke into regional groups, and we basically wanted to explore what do we need to have in place in order for faith communities, community-based organizations, and persons living with HIV to work together to respond to this pandemic. So the next slide is that's part of that history, and then you can go to the next one. The overall goal of the Faith Communities Project is to advance our HIV prevention and healthcare efforts. The way we have chosen to do that certainly is to look at ways. What that means for us is to increase awareness in faith communities as to the impact of HIV on their communities. And we do that by having educational programs, which is something that they requested, and I'll show you that in the next slide, where we bring together content experts, persons living with HIV, providers in the region, and also faith communities to really have a conversation in terms of how can the faith communities stay engaged and be supportive of persons living with HIV. Our second purpose is to mitigate the stigma that continues to be one of our greatest barriers to ending the epidemic in New York State, which is our focus now, because it's that stigma that continues to prevent people from getting tested, starting medication on time. People continue to some people hide their medication because they're afraid of how others are going to respond to them because they have chosen to learn about their health and to take charge of their health. So what we have done is to, when before the pandemic, we would have these educational programs in faith communities, and we would have we would invite providers to come in and to make testing, HIV, STIs, Hep C testing available. We encourage faith communities to recognize that HIV is a public health issue, and many faith communities, as you know, have health fairs and screening events. So we encourage them to remember to invite our community-based organizations to provide these testing, once again, as a way of mitigating the stigma. We usually, get permission if the pastor agrees, and we make testing available during our events. And our third purpose is to foster collaboration, encourage our faith communities and our community-based organizations to interact when we met face to face. But we felt it was important for the faith communities to know the community-based organizations in their community, and for the community-based organizations to get to know their faith communities, because faith leaders and members in their congregations, people reach out to them all the time. They come to them with questions and concerns. So it's important for them to know the resources in their community. So really, that's our purpose: to increase awareness, to mitigate the stigma, and certainly to foster partnerships between faith communities and community-based organizations. So the next slide. So what we did after our gathering in 2001 is we spent about a year and a half traveling across the state, asking the same question: what do you need? What do faith communities need? What do persons living with HIV needs? What do community-based organizations need? And as a result of that, we synthesized all that information. So what they said to us, they wanted a mechanism to have ongoing communication. So we developed like a resource, a listserv, a regional listserv, where we encourage them to share the information with us, and we share the information with the community. They requested educational information because they don't learn this stuff in divinity school. So that's why we started the educational programs that we continue to do today. Public communication, we have a listserv that for those clergy who they were very interested in learning about technical assistance. So we created and grants and other sorts of information. So we created that avenue for them to do that. Resources. We've developed videos. We've developed a resource called A Guide to HIV Education in Faith Communities. And then we also have a directory, which community-based organizations wanted to know, well, what services and ministries and programs do faith communities offer? So for those faith communities who agreed to, they're listed in this directory of ministries and services within faith communities. So this is how we've responded to the request that we received many years ago. Next slide. So we've done a lot over the 20 plus years, and I can't take the time to tell you everything, but in the chat there is a link to a document that really describes the history of the AIDS Institute and the New York State Department's efforts to work with faith communities, and you'll learn more about the Faith Communities Project. But here we have a listing of a number of our accomplishments. We've developed some videos where there'll be a link that you can go to our website also, and you can listen to these videos. The first one we created was on the Voices of Faith, and this was really made up of faith leaders from across the state of different interfaith group, and they really shared their decision to respond to the epidemic. And we recently created an additional video, which is, I think the next one shows it, and it's called Shining the Light on HIV Prevention, and where faith leaders talk about PrEP, but they also discuss why you can talk to me as your faith leader about this. Back in 2015, when the CDC presented the data on the number of the likelihood of a Black gay man or Latinx gay man developing HIV over a lifetime. We're looking at 1 in 2, 1 in 3, 1 in 4. That was alarming. So we took this information to the regional committees that we work with, regional committees across the state, and there are many of the we call them the mothers of the churches said to us, we want to learn more about this, because back in 2014, 2015, you had a lot of talk about gay marriages and everything else, and people really didn't understand what a lot of that meant. So they said to us, my granddaughter, my great granddaughter identifies as this. I don't really know what it means, so we should really do something about this. And they were able to go to their pastors and to say, can we host this program? And so we developed a series, one focused on how do you understanding gender identity and sexual orientation. And then the second focuses on how can faith communities respond to the needs of our LGBT youth. So lots of different things that we've done, over the years. And the next slide. So these are the videos, and like I said, the link is in the chat that you can listen to the I think it's on YouTube, and listen to the videos for both the Voices of Faith and Shining a Light on HIV Prevention. Next. The next slide. What's important is collaboration for us. That has been key. It's something that we promote amongst our providers, to collaborate with our faith communities. Well, we have collaborated with our partners in the New York City Department of Health. We've collaborated with federal partners, especially when the faith community said to us, we want to learn about, applying for grants. Well, back then, when they had the creation of the National Faith Initiative or Faith Center, every federal government had a liaison, or they developed programs to ensure that faith communities had equal access to apply for grants. So we partnered with the Administration for Children and Family Services, HUD, USDA. So we worked together to bring technical assistance and training to faith communities. I mentioned, let me see what else. And you can see some of the other things that we've done. We've also, what was important for us, we reached out to seminaries, because one of the things that we heard from faith communities is we don't hear anything about it. We didn't learn this stuff in seminaries. So we reached out to New York Theological Seminary, Union Theological Seminary, and we also looked at working with some of the medical schools to look at how are we addressing health issues, how are health issues being addressed in divinity schools, and then how are faith issues being addressed in medical schools, because we once again looking at ways to bridge this gap, but also to find a way to ensure that faith communities, have access to this information, both in their preparation and when they're in the communities. We have surveyed, provided numerous focus group, and every issue that we have an advisory group that we created. We've had summits to look at how can faith communities be truly involved in our efforts to end the epidemic in New York State. So we've done a lot, but we've also learned a lot. The next slide, please. Certainly one of the things that we've learned is that we cannot make assumptions when we talk about reaching out to faith communities. We can't make assumptions, the faith communities that people of color embrace. So we reached out to everyone because we didn't want it to be an afterthought. If so there are people of color who are Jewish, Buddhist, Christians, Catholic. So we reached out to as many faith communities that expressed an interest in that we felt that people embraced. So we didn't close the door. And to say that we learned that this is not easy. And this is not, working with faith communities is not one of those 9-to-5 jobs. You have to show up. You have to, as Brittany indicated, in terms of developing relationship with them so that they have their sense of trust. It's really helpful in the beginning to have our providers who were very, very involved in faith communities. Today it's very different because a lot of young people are they're not affiliated in the way that maybe their parents were affiliated. But many of them also define themselves as being spiritual more so than being religious. But it's important, first of all, to recognize that faith institutions are important, an important institution, and that they can certainly play a role in our efforts to respond to not only HIV, but to other public health issues. Go ahead. Next slide, please. So some of the take-home messages, are here. I mentioned this one, but sometimes people, what we have created has been to provide an opportunity for faith leaders, service providers, and persons living with HIV to come together to hear each other's voices. Because there are times that we enter environments and situations with assumptions about each other. So I think before we begin to work with faith communities, we have to check our own biases. We have to check our own assumptions, and to provide opportunities for for everybody to get together to be part of this conversation so we have a better understanding of what we need to do. We can't assume that faith communities will close the door on us. Some folks will say to us, well, they won't let you use condoms. Well, one of the pastors will say to us, well, you know what, don't put it out when we do, if you're tabling. Don't put it out because people, especially at the church, if they're having an affair, people are there, they're watching everybody else. But he said, you know what, there's a basket in my in each stall, you can put them there. So that's we didn't know that. This is something that we learned. So we cannot make assumptions about that. So the next couple of slides, and you can just go right through them, this is here, I mentioned this already. Beware of your biases, and that's really important. And also to be respectful of the diversity within each faith, and to take time to understand the nuances of the various faith communities that you work with, but to recognize that they can truly play a role in prevention, and not as an afterthought, but to know that you should invite them to the table, get to know, or have them invite you to their meetings so you can get to know some of the issues and concerns that they have. They can get to know you, and then you can really go in and continue that relationship with them. So let's look at just some pictures from some of our regional, and you can just really move through it. This is something that the first program we did in partnership with New York City Department of Health. This is from one of our regional programs up in the Bronx, looking at spiritual needs of persons living with HIV in Buffalo, not the Bronx. Go ahead. And this is our Buddhist gathering, we did one Buddhist response, looking at the Jewish response, looking at the, different faith traditions. This is one of our gender identity, sexual orientation program. And this was really wonderful because it was the first time that some congregations met a trans man. And had a young person who was there educating them about their community. Next. And this is, we're going to get ready to do this one particular church. This is the month of October. We do domestic violence and HIV. We try to do an interfaith communication. This year, we're focusing on looking at how faith communities can support young people who are especially our teens who are in dating violence situations. So that's coming up in a couple of weeks. And then, go ahead. This was once again working with the divinity schools, looking at transgender and gender non-conforming clergy panel. And this was wonderful. This was at the divinity school, and the first time that divinity students had an opportunity to meet trans faith leaders. And this is our website. You're welcome to, I believe it's in the chat, to explore our website for the various documents that I mentioned. And I think that's it. I think that's it. Yeah. I hope I didn't go over.
No, that was perfect. That was perfect. It was a great presentation, and I actually wish we had time to dig in more. I would have loved to have been a part of the audience for a lot of those meetings that you had. I'm very curious what came from them. I have a couple of questions, but I'm going to hold off and check in with our audience, our attendees, to see if anyone has any questions that they would like to pose. I didn't see any in the chat, but if you want to come off mute and ask Carol a question as it relates to your jurisdiction or just the information that she shared, please feel free. Okay. All right. Sarah, if you can stop sharing the screen. I have a few questions that I would like to pose to Carol to get some feedback. And then after that, I would like to kind of do a round robin and check in with each attendee to get more about their reasoning for joining today, and if there's anything specific that they would that they were hoping to get out of this meeting that we could hopefully address. So I jotted down a few questions. One question is, in these different meetings you've had from, like with the Buddhists, with the Jewish, from these different areas, these different faiths, what commonalities have you noticed about, their thoughts, approach, or whatever as it relates to addressing HIV? Have you noticed any commonalities there?
Right, whoops, what happened? Where am I? Okay. That commonality is what I mentioned in terms of I think each of them speak to their responsibility.
Okay.
Every faith tradition has that that guidance, and that is for us to care for our brothers and sisters. That's the basic tenet of all religions and spiritual traditions also. And that's was it. You talked about loving your brothers and sisters, being there, and that responsibility. That's the common ground. That's the link. And that is what you really focus on. It's not, our purpose has never been to challenge people's theology, because that's not what we do, but to really to go in and to say, what can you do? Recognizing that you do care about, your community, and this is an issue in the community. Do you think that you can do that you can work with us? And if you can, what do you think you can do? And if all they can do is to, excuse me, is to maybe have a brochure or to display some of our materials, then that's a step in the right direction, because it's important that people have that information. If they're willing to talk about, HIV, to include people living with HIV in their prayers as they're praying for people who are sick, once again, something that they've never done before. So we are not pushing, our beliefs on them or our ideas on them, but we're really approaching this more as how can we work together?
Mm-hmm.
How can we work together to respond to this public health, crisis that we're in, so that all of our brothers and sisters, will have access to information and hopefully the care that they need in order for them to survive.
And that's very interesting. In preparations for this webinar, I was looking over a few things. I came across some other survey information and was kind of surprised with some of the responses I saw around when they polled people, surveyed people to get their ideas about perceptions and attitudes. And so was surprised with some of the responses I saw around HIV and homosexuality, in that there was more open-mindedness than what I thought there was originally, and across the board with some of the faiths. So that was good to see,
Yeah.
and yeah, it's good to hear. I feel like once people start talking, we realize we have more in common
Right.
than there are differences.
Right.
And so what I'm also hearing you say is like, this is the approach, this is the technique. Come in looking for common ground, not looking to challenge theology. And so I want to ask, we have some health departments who are looking at ways for how do they build these partnerships with faith-based communities. And I noticed that at the federal level, with the Department of Health and Human Services, but also there are a few other health departments across the nation that have a either like a faith-based department, or they have a coordinator role similar to yours. So if there's a health department that is interested in having a faith-based coordinator, what would be your advice or recommendations about creating such a role and what it should look like and consist of? Because you mentioned this is not a 9 to 5 type of deal when it comes to doing the work to build these relationships.
I think first of all, it's the recognition of the role that faith community is. You have to believe that faith communities can make a difference. You have to believe that they belong at the table. And I think if you go in with that, if you believe that, then I think you're a step ahead in terms of, if you believe someone belongs at the table. If you're having a meeting, you say, oh, wait a minute, we need to include some faith communities, not after. If you're thinking about developing something, who should be at the table? Hopefully faith communities will be listed, or at least identified. I think that's the first step, because if they're not, and you're inviting them after, you've had your meetings and you've made your decisions or whatever, they'll feel that. So that's the first step, is to, if you have that commitment from your administrator, I think I was very, very fortunate to have administrators who were committed. They responded to the community. The community said to us, this is what we wanted. And they responded to the community's request. And there's that commitment. I mean, that's what we do. Engaging the community is what we do, responding to their needs, because we need them. We're in partnership with the community so that we can together, end this epidemic. So that commitment is there. I had administrators who believed that this was possible, and therefore they supported the creation of this position, recognized what needed to be done, and really in terms of the networking and everything that you had to do in order to foster this relationship. So in recognizing that, knowing that this is not a 9-to-5 job, knowing that I have to maybe show up and be at an event on a Saturday or Sunday or whatever, but to as knowing that that's necessary to establish the trust. So that's the key, is really to have administrators who understand and value the role of faith communities. And that really begins, like I said, in terms of checking your own issues with faith and your own perception with faith. And then once you're able to do that, then hopefully you'll be able to hire someone and be supportive of them in developing your goals,
Yeah,
developing the
I
program.
I agree with you. New York is very unique in that to have that support and the sustainability. So to know that you guys are 20 years strong in doing this is amazing. So I want to pause and check in with our other attendees to hear from them in terms of you know, what they was able to take away from today's session. If there's any specific question that they may have, I'm going to start with Hope Cassidy. If you're able to come off mute and just share a little bit with us. Okay. Jacqueline Graham, are you able to come off of mute and share a little bit with us today? Okay. And then I think this is pronounced Liquela. Did you want to come off mute and share or ask any questions today? Okay, no worries. I have a few more questions. This session is being recorded, so I want to be sure to ask questions that people may find useful. We know that people are dealing with the hurricane on the East Coast. I think that has a lot to do with why people weren't able to join us today. Um, I'm curious for your project. I have a couple of questions. When you're looking at, we're talking about, doing this faith-based work is not the traditional 9-to-5 kind of thing, but also, some of these concepts that we're going to people talking about, you talked about going to the seminaries and going to medical schools and, this are sometimes people's first time interacting with somebody who was transgender or really having an open conversation about HIV. And so I'm really curious, how do you navigate and what's your recommendations for people who are navigating this experience of being in a more corporate kind of feel environment versus operating in this faith-based space, which can come with a lot of tradition and it has its own type of structure, but just navigating those two different spaces. What recommendations do you have for that? Like, what observations have you made and recommendations do you have for just navigating that in a more seamless way?
Hmm. I think part of that begins with understanding why you're doing what you're doing. Understanding your goal, understanding the goal of your project, understanding the objectives. And I think if you understand that, I think that would guide you. So part of it for us was to certainly certainly to educate the community. We knew that. We wanted to connect our faith communities to our community-based organizations. So that was important. So those were the two things that was there for us in terms of knowing this is what we want to do. This was our goal, was to advance our HIV prevention and healthcare efforts. And these are the ways in which we were going to do it. And then if you enter that situation, then it's important that you explain, what it is that you're trying to do. With that, if you're entering to and you want to connect with whether it be at the seminary. Let's say, I'll give you an example in terms of just introducing yourself to the president of the seminary, and to say, this is who I am and this is what we would like to do. But also to say, and this is what we did, was to say, we did this assessment, and folks said that they didn't know much. They did not learn about HIV in seminaries. So the question is, how do you address health issues? How do you prepare, future seminarians and future, clergy to be responsive to their community? Some seminaries do have classes where they talk about health issues. And one of the pastors, he taught at the seminary, but he said, you know what? I have folks from the health department. He's down in the city. I have folks from the health department come in to my class and to teach people how to access their information, so that if they're they're back in their community, and they need to maybe look up information about, well, what's the hypertension or cardiovascular, rates or issues in my community, they know how to do it. So that's a wonderful, connection.
That is
That's
wonderful.
something that is something that he felt it was important for him to do, to prepare the students, the former the future clergy, to know how to access. And then the other part, in terms of bringing staff from the health department, of making that connection. Some hospitals do have programs. I know Mount Sinai has a spiritual care program where they bring in faith communities. And they also, I think they've made a commitment to, if someone within the faith community if a clergy has a member who's in need of care, don't have access, that they make those connections for them. So if that, hopefully that makes sense, is in terms of really understanding your role and looking at ways in which you can work together with that institution to accomplish that goal.
Okay. I'm going to ask you one final question and then we'll wrap up. So, in thinking about, if you can have anything, and thinking about prayers being answered. And when we're thinking about that in terms of, I'm thinking about EHE, ending the HIV epidemic. Our health departments have funds for that grant, and they're doing that work. And with you having, all of the experience that you have, and thinking about innovative ways to approach this, if you could do anything, money's not an issue, time, staffing's not an issue. What do you like? What's the most innovative? I don't want to say the most innovative. What do you think would be a very innovative way to a new strategy? That's what I'm getting at. A new strategy, a new something that you will want to do as it relates to doing this work with faith-based communities and HIV. What is something new that you will want to do, or that you think is needed to really push things forward in terms of ending the epidemic and really maximizing the role of faith-based organizations in that process?
Wow. That's very interesting. One of the things I think that comes to mind is, I would love to see faith leaders in some of the campaigns that are out there, as a way of, we did the video as a way for faith leaders to see their peers and to hear their peers, but some of the public health, campaigns, I would love to see voices of faith who are there. There's some folks, leaders in faith communities who are living with HIV and who are very open about that. But I think it would be really nice to see faith leaders on campaigns. Also having them, and we haven't, I think, I'm not certain if we have one this year, but we've had faith leaders on our prevention planning groups so that their voices are part of that conversation again. And this is another way of certainly connecting them. So having them at the table, having an advisory, like even if it's not statewide, if it's regional, but even on the, I think I mentioned that on the CDC folks, is to really have an advisory group of faith leaders you can tap into. But I think for us, really looking at ways in which we can clearly help the community to understand that HIV is a public health issue, and being able to connect it and to keep it there as a public health issue so that we can really wipe away that stigma that continues to be associated with HIV that prevents so many people from learning their status. So I don't know if that's I just want to see more faith leaders out there. So
Yeah.
on public
Yeah.
billboard talking about HIV.
That definitely answers the question. Thank you so much for your
You're
time,
welcome.
for sharing your knowledge, your wisdom, your expertise. We greatly appreciate it. I know our attendance numbers were low today, but this message is being recorded and it's going to reach many. And so, again, thank you so much. We really appreciate it. We're going to be sending out an evaluation. We would love to get your feedback about this webinar. We're going to send it in an email, and we're going to send this recording and the slide deck to all who attended. We had over 50 people who attended the webinar. So we look forward to getting this information out to everyone.
And
Thank you
Brittany,
all
thank you,
again.
Brittany. Thank you, Brittany, for having us. Thank you, Zoe, and your team. Really appreciate it.
Yes, no worries. All right. Well, we're right at time. Thank you all for joining us and have a great rest of your day.
Bye-bye.